All right, welcome everyone to panel 4, where we'll be discussing state and local labor markets. I'm your moderator, Kathleen Mellon from RAND. And in this session, we'll see 3 papers from Laura Quinby, Dara Lee Luca, and Gopi Shah Goda. If you have a question for Laura, Dara, or Gopi, please submit it via the Ask a Question button at any time during the panel. So let's get started. So the common theme that threads together these 3 papers is the importance of state and local areas. And I think that actually, as we kind of come to this conference, all from our offices, home offices and living rooms and bedrooms in some cases, all across the country, it really is emphasizing how important your state and local government is and the area that you're living in these days. So I think that this is actually a particularly timely session, and we'll learn a lot, I think, from these 3 papers. So each of the researchers approaches this sort of topic from a different angle. Laura's paper exploits a sort of a special population in the United States that faces different incentives and structures of their pension programs, state and local government workers. And this is really interesting, I think, because one challenge that many of us face as researchers studying the Social Security and disability insurance system in the United States is just the national, features of the program means that there's not a lot of variation that you can actually look at to see how people might respond to different, screening procedures or different, incentives. Just sort of how the programs are, we're all kind of facing the same program. And so what Laura and her co-authors do in that paper is to look at a group of people who are in the United States, so they don't have to go to another country, which is what we often do when we're trying to think about different ways of organizing systems like this. They can look at workers in the United States, but this population by virtue of their jobs that they hold, sometimes don't qualify for Social Security, or sometimes they have kind of an overlay of the state and local public pension program over that. So they're going to be looking at that population. The second paper, Dara, is going to look at relationships between local level factors and DI program outcomes. I think they're going to be focusing on beneficiary work activities. And so, as we, think about kind of how state and local governments are, responding, or just even the local economies are responding to this sort of nationwide crisis, but in very different ways. I think that this, could give us hints about things going forward, and is, potentially a preview of some really interesting research kind of down the line. And then finally, Gopi Shah Goda is going to present some research that focuses on interactions between Social Security and state and local pension programs. And they actually look at changes in retirement wealth stemming from changes to cost of living adjustments in these programs. And this is something where I think, as state and local governments are experiencing, unique budget pressures, in the face of the current pandemic, this will be something that'll be really interesting to see, just, not just from the perspective of how this affects the Social Security program broadly, but how, this is going to affect the workers themselves, I think, going forward, and also in the past. It's going to be really interesting. So I think these are really interesting research papers, and we'll learn a lot from them. Finally, the one thing I just really want to highlight here is to just thank the researchers for the fact that they're all building up these public, resources in the form of data collection and putting them together as a public good. So, as we as researchers know, research can take a really long time, years in some cases. And the first step, if the data that you need to answer the question that you want to address doesn't exist, is assembling that data. And so I think we can all thank the researchers who are providing this public good and potentially shaving months or maybe a year off of some future researchers' time, who want to study these questions. So let's get started. And the first paper is going to be Laura. So Laura, go ahead.
Great, thanks, Kathleen. I'm delighted to kick off this panel by sharing a project that I've been working on, disability insurance for state and local employees, a lay of the land. And this is joint work with Anek Belbaze and James Giles at Boston College. Next slide, please. Great. So this project was motivated by a simple question. Could state and local DI programs for public sector workers be used to study how benefit design affects substantive outcomes of interest, such as DI claiming? And let me give you a little background about this question before I outline the specific goals of our study. So Social Security Disability Insurance, or SSDI, serves as a much needed economic safety net for workers who can no longer continue in the labor force. But there is an ongoing debate about how best to design a DI program that protects households from loss of income while still encouraging work and persistence in the labor market. So meanwhile, state and local employees are covered by many different DI programs about which relatively little is known. Next slide, please. So this potential variation in DI policy is particularly important for public employees who don't have Social Security coverage on their current job. So about 1/4 of the public sector workforce in the state and local governments, or 6.5 million workers, actually do not have Social Security coverage on their current job. And while federal regulations ensure that pension benefits for uncovered workers meet minimum generosity standards to ensure comparability with Social Security, DI benefits are not similarly regulated. Next slide, please. So consequently, we had 3 goals going into this study. First, to create a publicly available database of state and local DI programs. And this database is going to be posted on the website of the Center for Retirement Research in the fall for anyone who is interested in using it. Second, to survey the state and local DI landscape with an eye toward policy variation that could be related to substantive outcomes of interest, such as claiming. And third, to assess whether the benefits earned by uncovered public employees are comparable to SSDI. Next slide, please. So the first step was to create the database of state and local DI eligibility requirements, benefit formulas, and DI roles. And it turns out that state and local DI programs are almost universally administered by retirement systems that also provide pension benefits. And so to create our database, we focused on the 100 largest retirement systems in an existing data set, the public plans database. And we found that, like retirement benefits, DI benefits vary based on an employee's occupation and hire date, even within a retirement system. So what we chose to do was to reflect all the occupational variation that existed within a DI program. But for tractability, we focused on the benefits for employees hired in 2020. Next slide, please. So the next step was to understand how state and local governments structure their DI programs. And governments have 2 primary levers that they can use to influence DI outcomes. The first are policies that regulate who can receive benefits, and the second are policies that regulate the generosity of benefits. So who can receive benefits is typically determined by 3 things in the state and local government programs: the vesting period, a workability requirement, and a medical examination requirement. And benefits are almost always set by a formula that is final average salary times tenure with the government employer times a benefit multiplier. Next slide, please. So for example, most programs in our sample restrict who can receive benefits by requiring employees first to vest. And this means that the employees have to achieve a certain level of government tenure. In our sample, the vesting periods ranged quite a bit, from immediate vesting to 8 or more years of government tenure, with most programs requiring 5 years of tenure in order to qualify for benefits. Next slide, please. And some programs further restrict access by tightening workability and medical evaluation requirements. So for example, while 75% of the programs in our sample only require that the disability prevent the employee from performing their previous job. 19% limit DI to employees who can't perform any job in the national economy. And an additional 6% actually require employees to first qualify for Ssdi before receiving employer benefits. Similarly, most programs allow the employee's own doctor to certify the employee's disability, but a few do require the employee to also have a medical examination by a doctor chosen by the program. And nearly half of the programs periodically reevaluate the employee's medical condition. Next slide, please. Beyond these eligibility rules, governments can also affect outcome through benefit generosity. So to explore this variation, we calculated replacement rates or benefits relative to pre-disability earnings for a hypothetical worker with 20 years of government service. And as you can see from the figure, while there was substantial variation in the replacement rates, about half of the programs sampled replaced between 32 and 48% of pre-disability earnings. Next slide, please. So a natural question at this point is whether this variation that I've been telling you about relates to any outcomes of interest, such as benefit claiming. Now, a full answer to this question is well beyond the scope of this study. So what we're going to do is just run a simple regression that illustrates how these data could be used in future research. And this simple regression just relates the fraction of all the beneficiaries in the parent retirement system who are on DI to various elements of program design. Next slide, please. The results of this simple exercise are intuitive, which suggests that the variation in program design captured in the new data set may actually be related to substantive outcomes of interest. So for example, DI programs that set strict eligibility requirements also have fewer beneficiaries, and relatively generous DI replacement rates are also positively associated with the share of beneficiaries on DI. And as we might expect, retirement systems that only cover public safety workers also have a higher share of beneficiaries on DI. Now, of course, this is a very simple reduced form regression. I'm not trying to imply that any of these associations are causal, but it is suggestive that the variation that we see in these state and local programs might be exploited for future studies with a more causal research design. Next slide, please. So the last goal of our study was to assess benefit adequacy for uncovered workers compared to Ssdi. And to make this assessment, we compared eligibility rules and replacement rates for just the programs that cover workers who are not participating in Social Security to Ssdi. And we generally found that eligibility criteria were less strict in state and local programs because they admit employees who are unable to perform their previous job, whereas Ssdi has a stricter requirement based on whether the employee can perform work in the national economy. To compare replacement rates, we simulated benefits for hypothetical workers with different lengths of government tenure. Next slide, please. The results of this exercise show that replacement rates in state and local programs typically exceed Ssdi for older workers who spend their full career in an uncovered government job. In contrast, workers who have short tenures, in the figure that I've shown here, this is the worker who needs DI at age 35, they typically fare better under Ssdi. However, since the risk of disability rises steeply with age, most short tenure workers who end up relying on DI may have spent some time in covered employment previous to joining the government, and so may also qualify for a partial Ssdi benefit on top of their employer benefit. So considered alongside the eligibility requirements, our assessment was that state and local DI benefits for uncovered workers seem adequate, at least relative to Ssdi. Next slide, please. So just to wrap up, we were looking at whether DI for public sector workers could be used to study how program structure affects claiming and other outcomes. To do this, we created a new database of state and local DI programs that will become publicly available. And we did a simple analysis just linking various elements of program structure to the share of beneficiaries on DI, and we did find some relationship, but we know that much work remains, and so really we're just intending to start a conversation rather than settle the debate. Thank you very much. Now we'll hear from Dara-Lee Luca.
Thanks, Laura and Kathy, for that introduction. So good afternoon, everyone. I'm excited to be presenting our new work on geographic determinants of beneficiary work activity today. This is joint work with Jody Schimmelheid at Mathematica and Jonathan Swabish at the Urban Institute and Paul O'Leary at SSA. Next slide, please. So I'll start with some motivation for this study. So we know from existing literature that there is substantial geographic variation in the prevalence of disability and disability benefit receipt, as well as the factors associated with these outcomes. But much less is known about geographic variation in beneficiary work activity and its determinants. From a policy perspective, it might be important to identify potential levers that could improve return to work among beneficiaries. Next slide, please. So in this study, we have two primary goals. So the first one is that we wanted to document geographic variation across the United States in beneficiary outcomes, including outcomes such as disability recipiency rate, new benefit awards, as well as employment and suspension or termination of benefits for work. So in the interest of time for this presentation, I'm going to be focusing on the third outcome, which is beneficiary employment outcomes. And then the second goal of the study is that we wanted to examine the associations between local area characteristics and beneficiary outcomes. So also not supposed to be a causal analysis, but trying to understand what are the local area characteristics that are most associated with beneficiary return to work activity. This analysis is going to be done at the PUMA year level. So PUMA stands for Public Use Microdata Area, which are defined by the US Census Bureau and represent areas within states that have at least 100,000 population. And we use PUMAs to minimize the share of cells masked by SSA for privacy reasons. Next slide, please. And to measure work activity among beneficiaries, we're relying on Social Security Administration's disability analysis file. This from 2001 to 2018. So the DAF includes SSA administrative data on DI and SSI beneficiaries, and we roll up this data from the zip code to the PUMA level. And then for this presentation, the main outcome I'm going to be focusing on is the percentage of working age beneficiaries with any positive earnings during the year. So this represents like any employment during the year at all. And this is based on earnings in the master's earnings file, which are reported to the IRS. Next slide, please. And for the local area characteristics, we're going to be using data from the American Community Survey. So this is an annual survey administered by the census that provide rich information on a broad set of characteristics that can be analyzed representative at the PUMA level, so including demographics, there's information on health factors, health access factors, and as well as economic and other factors. So I've listed the variables we are going to be using in this analysis here. So one caveat is that for the ACS data on PUMAs, we're only available from 2005 onwards. So our analysis is going to focus on data after 2005. And we're also using data from the Behavioral Risk Factor Surveillance System, or the BRFIS as it's more commonly known, from 2001 to 2018. And looking at percentage of adults who are currently smokers and percentage of adults who are overweight or obese. And these are available at the state level. Next slide, please. So I'll start with talking about some of our results. So this is the first set of results, and this is looking at variation in beneficiary work activity by PUMA in 2017. So we look at 2017 because some of the 2018 data may still not be, there might be some lag in that. So we're focusing 2017 as the latest year in our analysis. So interestingly, so the left-hand side looks at the percentage of working age DI beneficiaries who were employed at any point during the year, and the right-hand side looks at SSI beneficiaries. And you can see that in both sets of both maps, there's some common features, and that is like in the central northern states in the Midwest, like Minnesota, North Dakota, South Dakota, and also some of the mountain states like Colorado and Utah seem to have higher levels of beneficiary work activity. Another interesting thing to note is that there is high variation even within state. And I will also point out that how we measure employment is by any non-zero earnings. So it is possible, and this ranges from 0 to 50%. So some earnings we see could be from before the start of benefits begin for these people, and also could capture some earnings after benefits end if they're rolling off the programs. Next slide, please. And then we also do a simple regression analysis looking at which factors are most associated with work outcomes. And here we've listed kind of the things that seem to be common across both DI and SSI programs. So on the left-hand side lists the factors that are positively associated with beneficiary work activity, and the left-hand side is positive, and then the right-hand side are the factors that are negatively associated with beneficiary work activity. And as you can see, it seems like the results suggest that things like stronger local area economies or local labor market demand, especially for people with disabilities, are positively associated with beneficiary work activity. And then looking on the right-hand side column, the results seem to suggest that weak local economy, like as shown by unemployment rate or poverty rates, and risky health behaviors are negatively associated with beneficiary work activity. So I'll wrap up with a quick summary. So the first thing to note is that there is substantial variation in beneficiary work activity across PUMAs and even within state. We see some really interesting variation. There are key factors that seem to explain beneficiary work activity or correlated with, at least correlated with beneficiary work activity, are the availability of and access to economic opportunity, as well as risky health behaviors. So from a policy perspective, identifying characteristics that are correlated with lower than average disability beneficiary work activity might help to inform policies such as things like targeted mailings on incentives and programs that support return to work, such as SSA's Ticket to Work program. And you might also think that areas with higher levels of work activity or successful return to work by beneficiaries could be helpful in alerting policymakers to certain local area characteristics of policies that could potentially be emulated in other areas. So we hope this exercise is useful in generating more research on examining local area factors and how they might influence work activity. And as a final note, the data set we developed for this analysis is going to be made available in a public repository. And it will also include other SSA outcomes, including things like counts of beneficiaries, awards, the number of DI or people whose DI or SSI benefits were suspended or terminated, as well as other local area characteristics. And we hope that this will help facilitate future research in this area. Next slide, please. And that's it. Thank you. And I have included my email in case you have any questions. And next we will hear from Gopi Shagoda. Thank you.
Hello? Okay, great. Thank you for the opportunity to speak to you today. Could you go back, please? Previous slide. I'm happy to present research that I've been conducting with Maria Fitzpatrick about the cost of living adjustments, or COLAs, in public sector retirement plans. We're grateful to Social Security for funding this project. A significant share of the labor force consists of state and local employees who are, next slide please, who are eligible for retirement benefits from a state or locally administered plan. These plans are largely defined benefit pension plans, which generally specify an annual benefit level based on years of service, salary, and age. And of interest to us, many of these plans have some kind of mechanism to increase benefits among retirees to account for changes in the cost of living from year to year during retirement. And if you compare the assets the plans hold to their liabilities, specifically the benefits they have promised to future beneficiaries, many of these plans face a funding gap in that the assets they hold are not large enough to pay their future liabilities. Next slide, please. This figure shows the actuarial funded ratio, which is the ratio of the assets to the liabilities for state and local pension plans from 2001 to 2019, using data from the public plans database maintained by the Boston College Center for Retirement Research. As you can see, the funded ratio was over 100% in the early 2000s and has dropped to 72% in 2019. I'm sure it'll surprise no one here that 2020 is not likely to improve the pension funding situation in the wake of the COVID-19 pandemic. Next slide, please. Several retirement plans have investigated ways to deal with the funding gap by increasing retirement eligibility ages, reducing the generosity of benefit formulas, or changing future cost of living adjustments. However, plans that have sought to reduce their liabilities by increasing eligibility ages or making benefit formulas less generous have been challenged in courts, which have stated that benefit formulas in place at the time of hire must be honored at retirement. This means that states can only make these changes for new hires and that these changes will affect liabilities very gradually. However, reducing future cost of living adjustments, or COLAs, has been upheld in court and is a way that plans can reduce their liabilities for both current and future retirees. And so it has become a viable way for retirement plans who face large funding gaps to reduce their future liabilities. In this project, we build a database of, can you go to the next slide? In this project, we built a database of COLA changes between 2005 and 2018 to provide some data as to the prevalence and direction of these changes at both the plan and the employee level. We then estimate the potential impact of these changes on retirement behavior under various assumptions. Next slide, please. This project has consisted of a dedicated effort to create a database as comprehensive as possible, detailing the COLA in place for each retirement plan in each year between 2005 and 2018. We started with a roster of plans from the state and local public plans database, which covers 118 state and 82 local plans. We then assembled a team of wonderful research assistants who are hopefully tuning in at home, who comb through legislative records of bills passed in state legislatures, pension plan websites, comprehensive financial reports, and other plan documents, and as a last resort, contacted plan administrators. This data collection is ongoing as we speak, and what I'm about to show you now is data from 43 plans in 25 states. Next slide, please. So here are just a few examples of the information that we came across in this process. If you can read the slide, this is information from the New York State and local retirement system, which has a COLA equal to 50% of the annual CPI, subject to a floor of 1% and a cap of 3%. Next slide. By contrast, the state of Alaska public employees receive a COLA equal to 10% of their base benefits if eligible. Next slide. We merge our database of plan level COLAs to data from the American Community Survey, a large nationally representative cross-sectional data set that includes information regarding location, employment sector, and occupation. If a respondent is retired, they're asked about their employment details over the previous 5 years. We do not observe which plan a respondent is a member of in the American Community Survey, but we match in a sequence that first places public sector workers into a plan for their occupation in a particular city, and then cascades down to the most general plan that may apply to them. For instance, if I have a public employee who's a teacher in Chicago, I would assign the Chicago teacher's pension plan to her. If I have a public employee who's a teacher in a different location, I would match her to the Illinois teacher's public pension plan. And if I have a public employee who's not a teacher, I would then match her to the plan for Illinois state employees. Next slide. So the first thing we look at is the representativeness of the data we collected in terms of the public employees the plans represent. We compare the sample for whom we have complete data to public employees in the states represented and also the overall sample of public employees. Our sample is significantly more white, has a lower average income, and is less likely to be in the labor force currently. Next slide. So keeping this representativeness of our data in mind, we first show the prevalence of COLA changes at the plan level. As shown in this figure, in 2005, over 60% of the plans in our database experienced COLA rate changes relative to the prior year. The majority of these changes were positive, as shown by the blue portion. And in the last year of the data, a bit more than a quarter of plans experienced a change. Next slide. After merging with the ACS, we do the same analysis, but now at the population level. We find that over half of workers in our sample experienced any COLA change in the early part of our time frame, and on average across years, 43% of the sample experiences a COLA change. Next slide. The workers experiencing changes represent on average about 3.75 million workers each year out of the approximately 8 million workers represented by our annual sample. Next slide. When we break down this population into those experiencing a positive or negative change, we see that in the early part of our sample period, more individuals saw positive changes in their COLA. This changed in the wake of the Great Recession, where pension plans were more likely to reduce COLAs in our sample. In 2017, we again saw a resurgence of positive changes following high asset returns. But since COLA adjustments lag market returns, it's likely that we will see an increase of negative rate changes in the years ahead. Next slide. The last thing we do is try to understand how these COLA changes may affect retirement and claiming behavior. Since COLA changes affect the present value of retirement benefits and the returns to future work, they could change the labor supplied in both the public and private sector, as well as Social Security claiming. This is ultimately an empirical question, as it depends on competing income and substitution effects and requires panel data on affected workers, which the ACS unfortunately does not have. Next slide. So we hope to access data that would allow analysis of this question empirically, but in the meantime wanted to provide a benchmark analysis of how these changes could affect retirement behavior through some stylized examples. So we created a stylized public employee with 30 years of service who starts working at age 22 and estimate her pension wealth under a 3% COLA and a 0% COLA under various assumptions. We then use the change in the pension wealth and estimates of retirement elasticities to predict the change in the expected retirement age. Next slide. When we perform this analysis, we find that under our base set of assumptions, our stylized worker would lose approximately a third of her retirement wealth from this change in COLA. And using an elasticity of 0.16 that was taken from the literature, this equates to a delay in retirement of almost 5 months. Next slide. Okay, so unfortunately the animation I had isn't showing up, but we did vary the assumptions that we use in our calculations, which are detailed in our paper, and find that the expected change in retirement age changes with mortality, the assumed discount rate, years of service, the elasticity used, and the change in COLA we're examining. So to quickly summarize, we find that COLA adjustments are prevalent in state and local retirement plans, and that the direction of the adjustments tend to lag market conditions. Our simulation suggests that these changes could substantially affect retirement behavior. Going forward, we are actively continuing our data collection efforts and plan to investigate changes in labor supply using the 5-year history of labor supply in the ACS under some strong assumptions. We hope to relax these assumptions and analyze changes in labor supply using administrative panel data in a future project. Thank you, and we'll now go back to Kathleen Mullen for Q&A.
Sorry, everybody. Okay, technical difficulties. All right, thank you very much to the presenters. We do have some questions for them. So the first question is for Laura Quimby from Manasi Deshpande. Are these state and local DI programs administered by the governments themselves or by private DI companies? And who does the adjudication?
That is a great question. So the overwhelming majority of the programs are administered by the governments themselves. I only know of one that actually does outsource the administration to a private sector provider. And that I don't remember which one it is off the top of my head, but I remember seeing one, and that will be in the data. And the adjudication process, so that's another great question. Unfortunately, I don't know as much about it as I would like, because the governments are pretty opaque when it comes to providing information exactly about how adjudication occurs. In particular, we were hoping that we could find some information potentially similar to the grid that Ssdi uses for adjudicating cases to see whether in those programs that require that workers be unable to perform any job in the national economy, how they were judging that, for example, or how they were judging the severity of an employee's disability, and we just weren't able to obtain that information.
Okay. And there's a related question from David Gardner. Is there any evidence that state and local government DI benefits have a crowd-out effect on the availability of commercial disability insurance plans?
That's another great question to which I do not know the answer. But I would have to think about that. And so actually, let me think about that and potentially circle back on that one.
Okay. All right. We have a question for Dara Leluca from Jeffrey Sansenbacher. Does the local level variation you see in your data with respect to DI applications give any insight into the recent decline in DI applications nationwide?
That's also a really good question. We have started looking at trends, but I don't think we have identified anything very specific yet, but in future analysis, I'm sure we will look deeper into this. And again, that's something I'll probably have to circle back on, but that's a great question. Thank you.
Okay. All right. Also for Laura, oh, sorry, my emails are weird. Okay. For Laura Quimby from Abida Binti Abu Dhadi, what percentage of state and local public employees are also covered by Ssdi and Medicare? For those who are covered, how do you think state and local DI programs interact with Ssdi?
So that's a great question. So, so 3/4 of state and local, approximately 3/4 of state and local government employees are covered by Social Security and Ssdi on their current job. Medicare actually, so since the 1980s, all newly hired state and local government employees are eligible. So even in those states where they are not covered by Social Security on the job, they are covered by Medicare. And sorry, the last question, Kathleen, could you repeat? That was about, interactions between state and local programs and Ssdi, yes. So there weren't very many that we could see in the data, at least not in an administrative or programmatic sense. I'm sure there may actually be in practice as individual employees consider their decisions to either apply for state local DI, SSDI, or simply wait and try to claim retirement benefits. So in practice, I think that is something we would like to look at going forward, is how do all of these different incentives interact. Programmatically, the biggest interaction we could see was in the eligibility requirements, with some programs requiring the employee to first qualify for SSDI before becoming eligible for state or local DI.
Okay, great. So I have a question for Gopi, and maybe it's an impossible question, but do you, just sort of seeing how the budget pressures on the state and local governments have kind of bled into these, COLA changes, do you have any insight into what might happen, going forward because of the current crisis?
I do think that we're probably going to see more negative COLA changes going forward due to the recent conditions and the pressures on state and local funding in general. Pension plans are a large piece of state and local expenditures, and without being able to change benefit formulas for current retirees, it's very hard to change future liabilities without affecting the cost of living adjustment. Yeah. So I expect to see some more in the future.
Okay. All right. So I don't think we have any other questions from the audience. So I think we can just give everybody the gift of time and wrap up. So thank you very much to our presenters. It's fantastic hearing from you all. Our next session will start at 3 p.m. Eastern time, and look forward to seeing you all there. Thank you.